guest is Dr. Dennis Breen. He's a clinical cardiologist with Sacramento Heart. So what does a person do with this information? In my case, I got the equivalent of an A. I don't have a bad history in my family of various conditions, and I take good care of myself. What if someone got information, and it's not just information, you actually can see what they're talking about, where there's arterial clogging, where there's, lung issues. So both scenarios, what does someone like myself that got a good bill of health do with this information, and what does someone with some troubling information do?
We always hope that individuals will take this information to their personal physicians. Those individuals benefit most if they share this information with the doctors who know them the best. Mm-hmm. And that's your personal physician, who can integrate the information in these scans with what they know about you and can use it to your greatest advantage. There's a wealth of information in a whole body scan. It's really a compendium of things, and it's written in radiologic terms, so it isn't something that's easily understood by the average person or the layman.
That's where you come in.
And that's why we have a face-to-face sit-down.
Yes.
For the benefit of explaining and interpreting and translating medical terms into plain English. We do this with everyone who has this scan. And some people do it by phone, some people do it in person. I prefer to do it face-to-face.
Mm-hmm. Have you had people come in maybe to have their lungs looked at or their heart looked at? And as we mentioned earlier, it's not just specific. It's this is your body cavity. I'm pointing at my chest area, and even though my heart was scanned, they got little bits and pieces of my other organs. Have you had people come in, say, for a heart scan to find that their heart is fine, but there is a lung issue or a bone issue or, something completely different?
Exactly. When we're scanning the heart, we often see a little bit of the surrounding lung and other organs, and many times we find things by accident, serendipity. And these can be very valuable, and sometimes we pursue them with maybe a complete lung scan or even a whole body scan after doing a heart scan.
Very interesting. It says here the organs that are viewed with the scan, a full body scan, the heart's lungs, liver, kidneys, spine, pelvis, abdomen, pancreas, spleen, others such as your brain. Talk about the brain scan. That's fascinating.
Well, a brain scan is you might say an add-on. If you wanted to extend the whole body scan to the absolute limit, the brain scan is an important part. Now, who would want that? Well, I think it's a smaller group of individuals. Obviously, the brain is an important organ. We can see some indications of aging and other indications. For instance, in my body scan, the surprise was actually on the brain scan, because what I found I had was a sinus infection. That's part of the head, and that's included in the brain scan. So it can be a sort of an accidental discovery, but it actually helped me to understand why I had nasal stuffiness and was using nose drops so often.
Go figure. Well, and I don't know if you recall back to mine because it was a few months ago, but you found a slight abnormality in my heart, and this is where a professional person like a clinical cardiologist comes in. It's a fine line. I really appreciated what you said. You were very thorough, and you said this is an abnormality, but it's nothing to freak out about. This is not how all hearts are made, but don't go sit and rock in a corner in a catatonic state.
That's right. One of the criticisms of whole body scanning has been that it creates unnecessary anxiety. People learn so much about their bodies that they didn't know, and it becomes frightening or overwhelming. We are not perfect. We think we are, but when you look inside with something as detailed as a body scan, you see the little defects, the manufacturing defects I call them, which we all contain. And they're harmless, and they're totally innocuous and benign. But we don't want people to go away thinking that they're somehow destined for doom or an illness because they have some minor anomaly or abnormality that isn't significant in any meaningful way.
I have two Labradors that I got when one was 9 months old and the mom was 5 years old, and they both had heart conditions. And we were told, please take these dogs and love them as long as you can with these heart conditions. Well, the mom is 13, and the baby's 10, so this heart condition was really nothing to worry about, but they had to point it out. It was just an abnormality, like you said,
Exactly.
and it hasn't shortened their lifespan at all. How long does the test take? I imagine that varies whether it's a heart scan or a full body scan, things like that.
We're talking about 15 or 20 minutes. This is so simple. Literally, there are no needles involved. You don't have to do anything more than lay on a little a bed that goes through this metal thing, this ring or donut that is the CT scanner. And really, it doesn't take but, I don't know, in your case, probably 15 or 20 minutes.
I think so. And the results were, I don't know, didn't we talk about 15 minutes after that? It's really quite quick.
I think we spent a fair bit of time discussing the details. It depends on the amount of information and the degree of complexity of the findings. But I think we do spend as much time as necessary to answer all the questions. And we schedule these meetings after the test has been interpreted, so it isn't done the same day. I don't want people to think that they can walk in, get the scan, have the face-to-face meeting
and
with
off
me,
you go.
and then off they go. I think it takes a little more time. It has to be interpreted by a board-certified radiologist.
Now, in your case, and the way you're speaking to this audience speaks volumes about your skill with taking medical terminology and medical findings and then sitting down with someone like me and making it understandable. That's a skill in and of itself. You look at something that has potentially serious information and possibly at sometimes life-threatening information, and the symptoms and the conditions have huge, long, horrible words connected to them, and then you sit down with someone and make it understandable.
Well, that's part of our educational obligation, and I think with this test, we feel an obligation to educate and to help people understand. It isn't a good test if all they get is a packet of papers that they are told to take home or share with their own doctors.
And gobbledygook language that you don't understand.
Exactly.
Some of the conditions that people come in for, and we can go a little bit over these. People visit you for tests for various reasons. We didn't discuss